Which of the following factors can significantly reduce the risk of postoperative atrial fibrillation, AF, after CPB? A. Increased duration of surgery. B. Postoperative use of beta blockers. C. Use of high doses of corticosteroids. D. Hyperventilation during surgery. Answer: B. Postoperative use of beta blockers. Explanation: Beta blockers have been shown to reduce the incidence of postoperative atrial fibrillation, AF, likely by stabilizing the heart's electrical activity and preventing excessive sympathetic stimulation following CPB. Which of the following is the most significant factor contributing to endothelial dysfunction during CPB? A. Use of heparin. B. Mechanical trauma from the CPB circuit. C. Increased heart rate. D. Blood transfusion during surgery. Answer: B. Mechanical trauma from the CPB circuit. Explanation: The CPB circuit induces mechanical trauma to blood cells and the endothelium, which triggers an inflammatory response and endothelial dysfunction. This can contribute to thromboembolic events, coagulopathy, and organ damage during and after surgery. What is the primary mechanism of lung injury in patients undergoing long-duration CPB? A. Barotrauma from positive pressure ventilation. B. Atelectasis due to long periods of ventilation withdrawal. C. Inflammatory response and fluid shift. D. Pulmonary embolism during surgery. Answer: C. Inflammatory response and fluid shift. Explanation: In patients undergoing long-duration CPB, the systemic inflammatory response and fluid shifts contribute to pulmonary edema and acute lung injury. Inflammatory mediators lead to increased vascular permeability, resulting in fluid accumulation in the lungs. What is a known risk factor for long-term cognitive decline after CPB? A. Young age. B. Short duration of CPB. C. High blood pressure during surgery. D. Preoperative low cognitive function or age greater than 70 years. Answer: D. Preoperative low cognitive function or age greater than 70 years. Explanation: Patients who are older or have preoperative cognitive decline are at higher risk for long-term cognitive dysfunction or delirium after CPB. This is due to increased susceptibility to cerebral microemboli, reduced cerebral perfusion, and neuroinflammation. The use of which type of perfusion technique has been shown to reduce the incidence of renal injury during CPB? A. Retrograde perfusion. B. Pulsatile flow perfusion. C. Low flow perfusion. D. Non-pulsatile flow perfusion. Answer: B. Pulsatile flow perfusion. Explanation: Pulsatile flow perfusion more closely mimics normal physiological conditions, enhancing renal perfusion and reducing the risk of acute kidney injury, AKI, during CPB. It has been shown to improve organ oxygenation and function compared to non-pulsatile flow. Which of the following is a key protective strategy against myocardial injury during CPB? A. High-dose corticosteroids. B. Use of retrograde coronary perfusion. C. High-flow CPB with systemic cooling. D. Use of vasopressors during surgery. Answer: B. Use of retrograde coronary perfusion. Explanation: Retrograde coronary perfusion is a strategy used during CPB to deliver blood to the myocardium, particularly in the presence of aortic cross-clamping. This helps reduce myocardial ischemia and injury, preserving myocardial function during the procedure. What is the effect of hypothermia on organ function during CPB? A. It increases oxygen consumption in tissues. B. It exacerbates myocardial injury. C. It reduces the metabolic demand of organs. D. It accelerates the coagulation cascade. Answer: C. It reduces the metabolic demand of organs. Explanation: Hypothermia during CPB reduces the metabolic demand of tissues, thus providing a protective effect, especially on vulnerable organs such as the brain and heart. It slows enzymatic reactions and reduces oxygen consumption, which is crucial for protecting organs during periods of low perfusion. What is the most important factor in reducing the risk of renal injury during cardiopulmonary bypass in high-risk patients? A. Use of low-dose dopamine. B. Maintaining normal blood glucose levels. C. Maintaining adequate perfusion pressure and urine output. D. Administration of high-dose vitamin C. Answer: C. Maintaining adequate perfusion pressure and urine output. Explanation: the most important factor for preventing renal injury during CPB is ensuring adequate perfusion pressure and maintaining urine output. Adequate renal perfusion helps to preserve kidney function and minimize the risk of acute kidney injury, AKI, particularly in high-risk patients. Which of the following is a potential consequence of a prolonged aortic cross-clamp time during CPB? A. Cerebral ischemia. B. Hyperglycemia. C. Increased risk of deep vein thrombosis. D. Myocardial hypertrophy. Answer: A. Cerebral ischemia. Explanation: a prolonged aortic cross-clamp time can result in reduced perfusion to critical organs, including the brain, leading to cerebral ischemia and increased risk of neurological deficits. It is crucial to minimize cross-clamp time to protect the brain and other organs. Which organ is most affected by the inflammatory response initiated during CPB? A. Kidneys. B. Heart. C. Liver. D. Lungs. Answer: D. Lungs. Explanation: the lungs are highly sensitive to the systemic inflammatory response triggered by CPB. This can lead to post-perfusion lung injury, including pulmonary edema, impaired gas exchange, and acute respiratory distress syndrome, ARDS, particularly in patients with pre-existing pulmonary conditions.